Namaste. Happy New Year. Hope 2023 will be an excellent year for you in all respects. SLG Hello Doctor is glad to be back with you after a brief hiatus. We hope you missed us just as much as we missed bringing these health snippets to you. It is winter season. With it comes a lot of cheer, joy, and happiness, and many reasons to celebrate. On the flip side, it also brings along with it cough, a common complaint in both adults and kids. Doctors observe that cough is one of the most common conditions for which healthcare is sought. And then there is the matter of chronic cough. Globally, it affects approximately 10% of the population and is associated with a severely impaired quality of life. Today, we will be talking to our guest speaker, Dr. Aditya Vadan, consultant pulmonologist at SLG Hospitals, Hyderabad, about cough, its causes, tips for prevention, and effective management. Dr. Aditya, welcome to SLG Hello Doctor. It's such a pleasure to have you with us here today.
Thanks for having me over.
So shall we begin, Doctor?
Yeah.
When it comes to cough, all of us think we know what it is. Even the most minor throat irritation, we term it as cough. But as a doctor, what would you classify as cough?
Yes, when you have irritation over your skin, what is your immediate response for that irritation? You tend to scratch. In the same way, when you have some irritation in the throat or in the airways, we tend to have our own response that is called cough, where we inhale a lot and forcefully exhale against a closed glottis, which causes expulsion of that irritant which is there in the airway system, either upper airway or lower airway.
What are the causes of cough?
There's so many causes of cough. Just now I explained about how a cough is produced, but now I'll tell you about how a cough is caused, or what is the causes of cough. There are many causes of cough. There could be more than 100 causes of cough, but I'll tell you the most common causes of cough. Any irritants, like could be dust, smoke, cold, or any viral particles or anything that can cause irritation of our upper respiratory tract or the lower respiratory tract will cause cough. Sometimes patients who have viral illnesses, just like our COVID or flu or any pneumonias or tuberculosis, it all causes cough. So never take cough so lightly or easily. Please visit the nearest doctor at your convenience.
Again, I don't know whether this is a myth, but most of us associate cough with lung issues. So are there any other reasons too?
Yes, there are many causes of cough. Many reasons could be arising from the lung issues, or many reasons could be arising from the upper airway system, like sinusitis can cause cough, like middle ear impaction with wax can cause cough, like any gastric esophageal reflux, where people call it in layman terms acidity. Most of the people have reflux disease. It can also cause cough by irritation of all the receptors which is present in upper airways or the lower airways.
Doctor, it is winter, and almost every second person in every family is coughing. Why is this so?
Because there are many reasons for that. Cold atmosphere itself will cause cough, or cold atmosphere causes rise in the flu cases. Flus could be either COVID or H1N1 or many respiratory flus, which all of it can cause cough. There is a concept called mast cell activation post any viral infection or post any bacterial or viral infection. The mast cell activations causes release of this allergic mediators, which will cause cough. So even though your infection is subsided, still you will have persistent cough, which will be persistent to up till 8 weeks.
Can allergies cause cough?
Allergies are the most common cause of cough. Not all people have similar kind of allergies. People have so many kind of allergies. Some people have allergies for the food we eat. Some people have allergies for the air we breathe. So some people have allergies by the touch, by the contact of some certain kinds of ornaments we wear. So all come under allergies. So what I'm trying to emphasize is about the allergies which cause airway irritation and can cause cough. There's so many allergies can cause cough. when we eat certain kinds of foods, when patients are allergic to, they can have cough. When they inhale certain kinds of irritant dust or smoke or pollutants, it can also cause cough.
Doctor, how will a layperson understand what kind of allergies he or she is prone to?
Yes, it's a very good question. Most of the general population has some kind of allergies, some kind of mild allergies to some kinds of foods, some kind of air we breathe, or the dust particles or anything. So, in most of the patients have some kind of mild allergies, but what we are concerned about is people who have severe allergies or moderate allergies, where we need to where those kinds of patients would require some medical attention. So there are so many kinds of tests where we can see what kind of allergies you have. There's a simple blood test, or there is a skin prick test which is called allergic skin prick test. You will know what kinds of substances or eateries or any inhalants which you are allergic to. And if you are allergic to those kinds of things, you can probably avoid those things.
Doctor, coming back to cough, if it is persisting for longer periods, like say a month or two, what would be the causes?
Yes, if a cough is persisting for a lot of time, that is, we usually label it as a chronic cough, persisting more than 4 weeks or so. So, any person with chronic cough, allergy could be one of the reasons, but we have to rule out other reasons also, like infections. Tuberculosis is one of the main cause in Indian subpopulation, where the cough can persist for a longer time, associated with weight loss and fever. And there are other reasons of also for cough persisting for a longer time apart from allergies. As I've already told you in the previous when you have a viral illness, cough can persist for a longer time. So that's called post-viral cough. And other issues are pneumonias also can cause chronic cough. And one more thing which I want to add is, for chronic cough, never hesitate to show it to a nearby qualified pulmonologist. The other reason for cough would be malignancies. Any malignancies or cancers which is impending a mask-like lesion on the airways can also cause chronic cough, which will be very intractable to any kind of medications. So never hesitate to show to a nearby doctor.
Can you tell us about coughing in children?
Yes, coughing in children is very common. It could be a very minor reason also for that. But those minor reasons for cough can mostly neglected, or it has its own course where the cough will subside on its own. But there are some reasons where the children, especially playing children or young children, where a lot of household items would be kept nearby to them, and they happen to swallow them, and it can be aspirated into the lungs, which will also cause cough. So please don't ignore it.
It's break time on SLG Hello Doctor.
ప్రపంచ స్థాయి మల్టీ సూపర్ స్పెషాలిటీ హాస్పిటల్ SLG హాస్పిటల్స్. ప్రముఖ సామాజికవేత్త, సంఘ సంస్కర్త శ్రీ దండు శివరామరాజు, చైర్మన్ అండ్ మేనేజింగ్ డైరెక్టర్, మరియు శ్రీ డివిఎస్ సోమరాజు, ఎగ్జిక్యూటివ్ డైరెక్టర్ గారిచే స్థాపించబడిన SLG హాస్పిటల్స్
4 ఎకరాల సువిశాల ప్రాంగణంలో 999 బెడ్ల సౌకర్యంతో, గ్లోబల్ JCI అండ్ NABH ప్రమాణాలతో, అనుభవజ్ఞులైన వైద్య నిపుణులతో అత్యంత క్లిష్టమైన గుండె సమస్యలకు శస్త్రచికిత్సలు చేయబడును.
మెదడు మరియు నరాల సంబంధిత సమస్యలకు మొట్టమొదటిగా న్యూరో నావిగేషన్ టెక్నాలజీతో చికిత్స.
క్యాన్సర్ చికిత్స కోసం లీనాక్ వంటి అత్యాధునిక వైద్య పరికరాలతో చికిత్స.
కీళ్ల నొప్పులు, ఎముకలకు సంబంధించిన సమస్యలకు మరియు జీర్ణకోశ సంబంధిత వ్యాధులకు మెరుగైన వైద్యం అందించబడును.
20 అత్యాధునిక ఆపరేషన్ థియేటర్లు, 200 ICU బెడ్స్, అత్యాధునిక డయాలసిస్ సదుపాయం కలదు.
24 గంటలు ఎమర్జెన్సీ, డయాగ్నోస్టిక్, ఫార్మసీ సేవలు.
3 టెస్ట్ల MRI, CT స్కాన్ వంటి అత్యాధునిక వైద్య పరికరాలతో మరింత మెరుగైన సంరక్షణకు మీ ఎంపిక SLG హాస్పిటల్స్, నిజాంపేట్ రోడ్, బాచుపల్లి, హైదరాబాద్.
సెల్ నంబర్స్ 9133395500.
ఫోన్ నంబర్స్ 914023785678 మరియు 48525678.
టోల్ ఫ్రీ నంబర్ 1800599220.
ఎమర్జెన్సీ 7799235678. తెలంగాణ మరియు ఆంధ్ర ఆరోగ్యశ్రీ సౌకర్యం కలదు.
Welcome back to SLG Hello Doctor. We are in conversation with Dr. Aditya Vadan, consultant pulmonologist at SLG Hospitals, Hyderabad, about cough. Doctor, this is something the whole world talks about, the ill effects of smoking. Can you talk to us about smoking with relevance to cough?
As you can see a cigarette packet where there is a statutory warning saying that smoking kills. So that itself should answer all your questions, because whenever you smoke, that has been happening to your body, not just lungs, your entire body. Smoking is prone to cancers, as everyone knows. Smoking is not just prone to lung cancer, it can be prone to oral cancers or cancers in the GI system or anywhere, in fact. So smoking also causes lot of cough, and there is other medical conditions which is related to smoking, which is called chronic obstructive pulmonary disease, where a patient smokes more than 15 to 20 cigarettes for more than 15 to 20 years. They develop a condition called chronic obstructive pulmonary disease, where cough will be the predominant symptom. Later part of the disease, they tend to have some breathlessness associated with it. And if you leave the disease like that, it can cause a lot of problems to a patient, where the quality of living will be drastically reduced.
Doctor, asthma patients, as it is, struggle to catch a breath. If they contract a cough or a chronic cough, then what happens?
Yes, asthma itself will present with a cough in most of the patients. So asthma itself will present as a cough. So usually what I see is many of the doctors, they don't classify a patient under asthma. So treating cough, generalized cough is just allergic cough is one part of the aspect. But when you label someone as asthma and treating cough which is caused due to asthma is an entirely different treatment. It's highly imperative that a patient should be classified as a asthma or just an allergic cough or just a post-viral cough or any of that sort, because the treatment varies.
Doctor, with so much pollution all around us, smog, smoke, haze, you name it, vehicular pollution, so how does one avoid, contracting a cough as a result of all this around us?
Hyderabad is among the top 4 most polluted cities in our country, and inarguably Hyderabad is the most polluted city in India. So there is a lot of different kinds of pollutants which we inhale, like particulate matter 2.5, PM10. What is the area of interest would be PM 2.5, where the particle size is less than 2.5 microns, and it can easily enter into our distal airways, and it can lodge there and can cause reactive airway dysfunction syndrome as well as cough. These patients will have asthma-like symptoms, mild asthma-like symptoms, cough, which usually doesn't respond much to the medications also. So these kinds of pollutants can be avoided by wearing masks, which obstructs which restricts the particles going through our noses or throat into the airways. So kindly wear mask and avoid all these kinds of pollutants like PM 2.5 and PM 10. And these days, people residing near the industrial areas like Bachapalli, where previously there used to be a lot of industries where the pollutants are released in the atmosphere, pollutants are released in the water as well. So people residing closer to any industries, they have asthma-like symptoms. So kindly visit a pulmonologist who is a specialist who can clearly guide you in solving those kinds of issues.
Doctor, I have a question which I am sure I would be asking on behalf of all the children in the world. Does drinking cold water or having ice cream lead to throat infection and to cough?
Yes, drinking cold water or having an ice cream would lead to sore throat, cough, and a lot of other illnesses as well, because it has a lot of sugars. It is very cold. So I would sincerely advise all the people who are susceptible to these kinds of items, ask them to avoid.
So doctor, with COVID once again raising its ugly head, What is the interrelationship between cough and COVID?
I see a lot of patients coming to the OPD with COVID and cough, because any patient who has recovered from this viral illness, their cough will persist for more than 8 weeks or sometimes more than 2 to 3 months. We label them as long COVID. Not only cough, they are presented with memory loss, hair loss, muscle fatigue, generalized weakness, and cough. So these kinds of patients should be appropriately treated with the necessary medication.
Doctor, when it comes to cough, one has got so used to it that anybody in the family, would come up and say, okay, this is a home remedy, try this, or this is an Ayurvedic prescription, try this. Is it good that we kind of intake those kind of things? First of all, that's one question. Secondly, we also get over-the-counter medicines like Benadryl very easily. Nobody asks for a prescription from a doctor for that. So are either of these good in the long run?
There are two kinds of cough. One is wet cough and one is dry cough. Wet cough is something where a lot of expectoration is produced. Expectoration is nothing but phlegm. Dry cough is something where there is no expectoration is produced or no phlegm is produced. This is called dry cough. So there are different medications targeting the wet cough. There are different medications targeting the dry cough. So when you take an appropriate cough syrup targeting the dry cough, your dry cough will subside. When you take appropriate cough syrups where you have a lot of phlegm and infective sputum is there, then you have to give medicines targeting the wet cough. So, and a lot of home remedies are also there for cough, like honey and ginger, which can also help in cough, mildly relieving cough.
So grateful to you, Dr. Aditya, for joining us here on SLG Hello Doctor and talking to us about cough and its reasons, causes, effects, and preventive tips.
Thank you so much for inviting me over.
Our pleasure.
Thank you.
Viewers, let's remember to inculcate at least some of the habits that Dr. Aditya just spoke about to improve our quality of life. We will be back with you in 2 weeks from now with yet another topic of importance. Until then, take care and do enjoy the winter season, but with a little caution. Viewers, hope you've hit the bell icon and are following all that's happening on SLG Hello Doctor. If not, do it right away.